In this video, we will be discussing the thyroid gland as we continue our study of the neck. So, our learning objective in this video is to describe the location, parts, and anatomical relations and blood vessels of the thyroid gland. So let's get started. All right, so here we're just looking at a picture and letters of the thyroid gland, and you should have learned maybe at some point a little bit about the thyroid gland, and I know you'll talk about it more in physiology too, but this is an endocrine gland, so it's part of the endocrine system that secretes 3 different hormones. It's going to secrete T4 or thyroxine, T3 or thyronine, which is T3, and those are going to help stimulate the metabolic rate. It also secretes calcitonin, which will help to lower blood calcium levels. And you'll talk about that in much more detail, like I said, in physiology too. You can't see in this photo here, but the thyroid gland is also going to be surrounded by this connective tissue sheath that comes from the pretracheal layer of the deep cervical fascia, which you remember we talked about early on in our study of the neck. And this connective tissue will connect the thyroid gland to the trachea and larynx, which are located posterior to the thyroid. And the significance of this is that because it's connected to the trachea and larynx, when you swallow, the thyroid gland will move up and down. So if you had a patient that said they had a mass in their neck, one of the things you would have them do, or especially in their anterior neck, one of the things you would have them do is swallow and see if the mass moves up and down, because that means it could likely be in the thyroid. But as you look at this picture, you can see the different parts of the thyroid. You have 2 lobes, which are located on either side, and these are going to be about like a pear shape. At the top, it's reaching at about the level of the thyroid cartilage, the oblique line of the thyroid cartilage, and then downward it will reach here at its base at about the 4th or 5th tracheal cartilage. So these are the lobes. Here in the middle, this part you see here, this is known as the isthmus. Sorry, I cannot say that word for some reason. And it's going to kind of go across the midline here, and it's going to be immediately anterior to the 2nd and 3rd tracheal cartilages. So the lobes are going to reach all the way down to the 4th or 5th cartilage. The isthmus is going to be there kind of spanning the 2nd and 3rd tracheal cartilages. Some people will also have this pyramidal lobe, which is like a finger-like projection that will extend upward from the isthmus, usually just left of the midline. And this is really just a remnant of embryological development. The thyroid is actually derived from endoderm, if you remember talking a little bit about this in DAA, and starts to develop in the oral cavity with the tongue. And as development continues, the thyroid will descend to its final location here, surrounding the trachea and the larynx, and it will be connected to the tongue still as it descends by this duct called the thyroglossal duct. And in some people, the duct will disappear in most people, but in some people, there will be a remnant of the thyroglossal duct, and this remnant will be this pyramidal lobe. So it's not in everybody, and like I said, just interestingly, it's here because of the developmental history of the thyroid gland. So now let's talk about anatomical relations of the lobes. In your notes, you've got a cross-sectional picture that you can look at, but I think that you really can get a good idea by looking in VH dissector, because remember, VH dissector, that is a real human donor. So if you study with VH dissector, you really get a good idea of what the donors are going to look like in the lab, and it can help you with your lab practicals. So let's go look at that. All right. here in VH Dissector, I have highlighted the thyroid in this kind of pinkish color. You see the trachea behind it, that's in purple. And even behind that is going to be the esophagus. But let's talk a little bit about, so I've got a cross section in VH Dissector right here. So we can see the structures that are directly located to this. So in front of the, we're talking about the lobes now. So in front of the lobes, or anterior laterally to the lobes, we're going to have some muscles. We are going to have the sternothyroid, which is going to cover the gland directly. And check this out. I can actually add that muscle in. So there you see it right there. Oh, that's the wrong one. This is the sternothyroid. This is the sternohyoid on this side. So let me add the sternothyroid, and then let me add the sternohyoid. So now you see how those are right there in front of the thyroid. So in lab, you have to reflect these muscles to be able to see the thyroid gland. And you also are going to see the anterior border of the sternocleidomastoid. So there we go. So now posterior laterally, let's take a look at that. I'm going to take away these muscles that I just added in. So I added in the sternothyroid, the sternohyoid, and the anterior border of the sternocleidomastoid. So now let's look posterior laterally to the lobes. Okay, so we're looking at the lobes right here. You will see, and they're already here, you're going to see the carotid sheath with its contents. So that's going to be the internal jugular vein. It's the wrong color. That's going to be the vagus nerve, also the wrong color. And then it's going to be the common carotid artery. So those would be covered with a sheath. That is the carotid sheath, and that contains the internal jugular vein, the vagus nerve, and the common carotid artery. And you see that vagus nerve traveling right there, kind of in between there and situated a little bit posteriorly. That picture that's in your notes doesn't show it quite accurately. This is more accurate representation. So then medially, if we want to look medially, we're going to have to turn this donor to the side and get rid of the thyroid. So remember I said the thyroid was this pinkish lavender color. I'm going to go ahead and exit out. So now everything we're seeing is just medial to it, right? Because I've turned this to the side. I've taken off the thyroid gland, and now I can see what's located inside. And you're going to see that it includes the esophagus. Let's make that a different color than the trachea. So you see the trachea, you see the esophagus. Those are located medially to the lobe. And then, but if we were a little bit higher in the thyroid gland, you would see that it's also going to be located medially to the pharynx and the larynx. So that kind of, the larynx and the pharynx are going to be continuous with the trachea and the esophagus respectively. So that's what you're going to see medial to the thyroid. I'll add it back in a minute to really show you. And then also you will see the external laryngeal nerve, which it's right here. You're seeing superior laryngeal nerve. This is the external branch of the superior laryngeal nerve, and that's going to supply this muscle you see here, which is the cricoid muscle, and we'll talk about that muscle more later on. And then also the recurrent laryngeal nerve, which you're seeing right there. So if I go to my cross section and I bring it back up, I can add that thyroid back in. And you will see now that if everything I just talked about would have been just medial to that lobe. Now posteriorly on the glands, the lobes of the thyroid gland, you would see the parathyroid glands. And we're going to talk about the parathyroid glands in another video. But in this, I went ahead and removed everything that would be posterior to the thyroid, or that isn't immediately posterior. And you see these little green glands. There's actually 4 of them. I'd have to move it around a little bit more for you to see them, but they're a little bit variable, and we'll talk about that more when we talk about them in location. But they'll be posterior to the lobes, and those are the parathyroid glands. Now, let's talk about the isthmus. So remember, the isthmus is going to span across the 2 lobes, or in between the 2 lobes, and be at the level, or span about the level of the second or third tracheal cartilage. And the isthmus is going to see, all right, so I'm going to bring the cross section back up to the thyroid. And remember, we're going to be at the isthmus, so we're right about here. I'm right there. The isthmus is right behind it. And you are going to see anterior to it the sternohyoid and the sternothyroid, just like the lobes. And let me highlight those in different colors so you can see the difference. And then posteriorly is going to be the second and third tracheal cartilages. So there's the trachea. It's right there behind that isthmus. And that is simple enough. Now let's talk about the arteries that supply the thyroid. For that, we're going to look back at Netter's. The thyroid is going to be supplied by a couple different arteries. It's going to be the superior thyroid artery, which you see here, it's been cut, but that's the superior thyroid artery. And then the inferior thyroid artery, which you're seeing right here. The superior thyroid artery is going to be a branch of the external carotid artery, and the inferior thyroid artery is a branch of the thyrocervical trunk from the first part of the subclavian artery. That's significant because this artery is really getting its supply from 2 different major arteries. So if there is something that is affecting one of these arteries, there's going to be another way for the thyroid to get blood. Now, in some people, there's going to be one other artery, and this is the thyroid ima artery. And ima means lowest. This is only present in about 10% of people, and it is a unpaired artery of the thyroid. Usually it'll branch from the brachiocephalic trunk, or it could even branch from the aortic arch, and it'll send on the anterior surface of the trachea to reach the isthmus and pretty much be right there in the middle. So this is important, and I know that you're not going to be doing any tracheotomies, but you may have patients that have gotten them. When a doctor does a tracheotomy, they have to go either to the left or the right, usually because they need to be cognizant that there might be this artery present right there in the middle of the trachea, and they don't want to cause bleeding. And here in this picture, you can see the inferior thyroid artery and the superior thyroid artery. And the veins are going to be similar. So it's going to be superior middle thyroid veins. And the superior middle thyroid veins are going to drain into the internal jugular veins. And then there's the inferior thyroid vein, which will descend anterior to the trachea and posterior to the meningeum, the sternum, and drain into the corresponding brachiocephalic vein. And sometimes you'll see that form a single trunk, and it'll drain into the left brachiocephalic vein. So if we look at the VH dissector, he actually has that single trunk right here. Get this out of the way. So I think this is kind of interesting to see. Let me get those muscles out of the way. And you see that single trunk here, and that'll drain into the left brachiocephalic vein. So you could have 2 of these, and they'll drain into the corresponding side for brachiocephalic vein. but it could be this single trunk. And then the superior and middle thyroid veins will drain into the internal jugular vein. And you can see all three in this picture. There's the superior, middle, and inferior vein. So now you should be able to describe the location, parts, anatomical relations, and blood vessels of the thyroid gland.